and we're at about the halfway point in the event today. And I've got the pleasure of inviting on Alexia Priest, distinguished HITLAB fellow and former Boehringer Ingelheim executive, to introduce her panel with Shawn Smith and Kristin Norton. Alexia, over to you.
Okay, I'm trying to get this. Oh, here it is. I'm sorry, there's a bright light. Bright lights. Hello, everyone. I hope you're enjoying the symposium here. As Jerry, thank you for the introduction. I appreciate it. I'm here to engage with colleagues, Shawn Smith, CEO at One True Health, and Dr. Kristin Norton, CEO of Green Room, and the panel is entitled How Patient Engagement Can Improve Last Mile Access and Equity. So with that being said, we'll start with the females first. So Kristin, would you mind introducing yourself? I would appreciate
absolutely.
it.
Hi, yes, thanks for having me here. I appreciate it, Alexia and the HITLAB. So I'm Kristen Norton, and I'm CEO of Green Room Technologies. My background happens to be in cardiovascular science, and specifically the neural control of the cardiovascular system during space flight. All that being said, in that I found myself as I was in research studies, going down the hall to listen and learn from all my colleagues about the types of technologies and studies that they were doing. And eventually that led me to form Green Room, in which my partners and I, my Chief Medical Officer, Bob Teague, and Chief Technology Officer, Daryl Welk, work to help medical devices and software successfully launch their products in the US healthcare market.
Great, thanks, Kristin. And Shawn, would you care to introduce yourself briefly?
Sure. Thank you so much. Really an honor to be here today. My name is Shawn Smith, and I'm the CEO of One True Health. We have a family of companies based out of Austin, Texas. Our care management company is focused on providing technology-enabled virtual first preventative care, primarily for Medicare-eligible seniors suffering from chronic and acute conditions. And we have a technology company called One True Health Technology that focuses on putting patients in control of their medical data through a personal health record and through a comprehensive care plan that gives them actionable insights on what they can do to get healthy and to stay healthy. And it's an absolute pleasure to be here today.
Great, thank you. Welcome to you both. We really appreciate you having you here. So, Kristin, at Green Room, you have a long history of working with health care organizations, especially in Texas. I'm familiar with MD Anderson there. I did a very big collaboration deal with them. Wonderful place to be. How would you describe last mile access to care issues for COVID, and how did the pandemic change that?
Yeah, it's a great question, especially relevant to Texas, as it's such a huge state and so many rural areas that are underserved. And I really thinking about it, I was thinking that there really are both physical, financial, and cultural barriers to care delivery in these rural locations. And they come on the part of both the healthcare system and the patient. So from the healthcare system, it may be a lack of facilities or providers and staff, especially in certain specialties, equipment and devices, again, that are relevant to certain specialties, but even just basic programming and services and the coordination of benefits from the government and insurance carriers to cover those. So they're really, suffering on their sides with lack of their own access on their end. But the patient experiences even more so, in that they have the additional burden of their own lack of finances or transportation. Potentially. And they also have this, infrastructure issues. It could be network connectivity. It could be the roads wash out, in their area in certain times of the season. So they're all, or a tornado. I mean, there's all kinds of things that happen in our community. But on both sides, I really find it to be, there's some cultural issues, cultural, educational, language disparities on the patient side, and on the healthcare community side, a traditional lack of willingness to adopt new technologies, which I hope we're starting to break through with new things like One True Health.
Wonderful. We also see there's been a delay in adopting these new technologies, which could be so beneficial to the patient.
Exactly. And Alexia, let me say that the COVID really just increased those issues for everyone. You know, it made it even harder on all those things. And it added the fact that maybe you don't want to go to the doctor even more so because you might get sick when you're there, or it might be, the place might be filled up with patients from COVID. But that did help bring about telemedicine to a higher level, as well as more consumer care, which is a very important change in our ecosystem.
Yeah, absolutely. I really enjoyed the introduction of telemedicine. It's so great to be able to, address a simple issue and then be done with it instead of going to the car, on and on and on.
It's the rise of consumer-based care.
Right. Okay, thank you for that, Kristen. Shawn, True Health has a specific focus on rural communities with respect to providing access to care and access to actionable health information. Can you answer the same question as Kristen, and how would you describe last mile access to care issues before COVID, and how did the pandemic change that?
Well, it changes dramatically. We have the honor of serving partners, clinical practices, hospitals, health systems in rural Texas and other rural communities across the nation. And we all knew even before the pandemic that access to care is an issue in rural America. Kristen was touching on it. They also have some definite inequities. Lower income seniors and seniors of color are disproportionately affected, especially in rural communities, with respect to access to care and access to actionable health information, which is our passion to provide those kinds of services into that care alongside of our clinical partners. But COVID itself just supersized the problem. Did you know that 40% of American seniors didn't see a physician in person or through telehealth during the pandemic?
Oh,
and
my heavens.
You have a silver tsunami coming to our emergency departments now of chronic and acute conditions. Of course, diabetes, hypertension, heart disease, cancer. It's the most pressing issues in healthcare. $3 trillion of annual spend on chronic and acute disease management is just going to get more expensive because they didn't get the care they needed during the pandemic at home to take care of these issues. And in rural communities, again, just even worse. So they had trouble seeing the doctor. Think of all even the social determinants of health, food insecurities, transportation difficulties in rural health in rural America. And COVID just created a monster of a problem that we're dealing with now in rural hospitals across the U.S.
Are you seeing more of an uptick in lung disease or lung scarring as a result of COVID?
Uptick in all chronic and acute diseases across the board. Certainly diabetes, the higher incidences there. There are hospitalizations that are occurring based on many different conditions that could be monitored with, what we call the 4 pillars of health. Diet, what someone's eating, their nutrition, their exercise or movement for seniors, sleep quality, stress management, and boy, the social isolation and loneliness, during the pandemic supersized that problem as well, especially in American seniors. So it's just a tremendous issue, and again, one that payers are looking at, hospitals are looking at as a increased problem, because the Great Resignation that occurred during the pandemic means staffing issues. There's just not the ability of following the patients home, especially in rural hospitals where they were already challenged with respect to staffing. But they don't have the case managers to follow the patients home. They don't have can't give them the attention that they need for chronic and acute disease management. And it's the same in senior living communities. 86% of assisted living facilities report moderate to severe staffing shortages. And this is a tremendous problem in terms of last mile access to care.
Wow. Yeah, and I'm hearing that there is a decrease in people going into medicine, a significant, so it's only going to get worse.
Very much a staffing shortage.
And Kristen, you can speak to that, right?
Yeah, absolutely. There's been very much a staffing shortage, and especially in these rural communities, both on the provider side and on the nursing side. And so we see a real need to bring care closer to the patient using care navigators and folks that can really engage people at home.
Okay, Kristen, as Green Room partners with digital health organizations, what technologies have you seen that can make a positive influence on last mile care delivery?
I'll take that in kind of in two ways. So one thing I've noticed is a lot of the rise of consumer care, the direct to consumer care. And in the younger, more tech savvy group, that means finding something on social media where you used to use these types of companies for perhaps STDs or birth control and things of that nature, or hair loss. Now it's expanding into more and more areas, ADHD, migraines, et cetera, where people go online and get engaged that way, get their assessment, their treatment, and get their medications delivered to their home. So that's happening a lot in the younger, more savvy community. And in the more senior community, we're really seeing more and more of a need for and more of a support in the government and insurers for remote patient monitoring. So there's this paradigm of having some kind of sensor or device at home, some kind of patient engagement platform, and then the care navigation and stuff beyond that helps support all of that. And that's one of the things that we love about One True Health is they've found a really unique combination of technology and service that can help provide that to the seniors at home, even in the remote care areas, because they're able to provide a digital health companion that's dedicated for that reason and is well connected, or they don't have to worry about their cellular system dropping off or not knowing where to find an app on the phone. So really paying attention to that population and their specific needs, how to engage them, how to retain them, and how to deliver the service to them in a way that they can consume has been very important. And I really, really enjoy seeing One True Health and other companies come up to the speed with that.
And Kristen, I'll tie into that if you don't mind, because patient engagement is really the issue. That's the problem that they have right now. Clinical practices, hospitals, health systems in that last mile is they lost track of their patients during the pandemic, and they're now trying to use technologies to re-engage them. We're honored to be partnering with the University of Texas at Dallas and with T-Mobile on a unique patient engagement platform of using a Samsung tablet for seniors that are not tech savvy. So imagine a senior that really doesn't use a smartphone, has the old flip phone, but still needs to follow care plan instructions from hospitals. So upon a transition from the hospital, they can be provided this tablet that has 5G service in rural communities where broadband is a problem. And it can have a kiosk approach to give them actionable health information. And it can serve, like you said, as that digital companion where the system can voice prompt the patient to say, hey, Susie, it's 2 p.m. time to take your medications. It's those 2 blue pills here on the screen. And she can, acknowledge that with a click of a button. So, we're trying to provide for our clinical partners the kind of technology solutions for patient engagement and to solve that staffing problem in rural communities.
Shawn, I would add to that, the other, I think, unique thing about what's happening today is as care becomes more consumer based and as companies like yours move innovation closer to the patient at home, I think that's the idea of having patients having access to and control of their own information in a way that they can understand and actually contribute and be involved in their own healthcare. I think that's a huge innovation that's occurring.
Absolutely.
Yeah, absolutely. And also, especially because that's a growing population, people are living longer, and having voice activated devices is really going to be key and critical. Finger nibbling and punching through the phones gets rather tedious and difficult. Jerry, are we running out of time here?
Yes, I'm afraid so, Alexia.
Okay.
I'm sure you guys could definitely go on for a little bit longer, but Shawn and Kristen, if you guys are available to connect with the audience at 2 p.m., I'm sure they would love to hear more from you, and of course connect with you over LinkedIn and check out your websites to your companies as well.
Sounds wonderful. Thank you for the opportunity. Appreciate it.
Thank you very much.
No, thank you both, and thank you, Alexia, for moderating a wonderful conversation around not only just focusing on digital health in the last mile, but also, direct, as Shawn said, to the 50+ community as well. So thanks so much for facilitating that.
Okay, thanks, Jerry. Thanks, everyone. Have a wonderful rest of the seminar.
Thank you, Alexia.